Stop scrolling if you are yet to book your OSCE. You need to watch this video before you take your OSCE. And if you know anyone who is preparing to write their OSCE, please make sure you forward this video to them. Also, don't forget to like, share, and follow this account for more information regarding how you can become a nursing associate, a nurse, or a midwife here in the UK. My name is Gentle. I talk about OSCE, CBT, and other stuff regarding the registration to become a nurse or a midwife or a nursing associate here in the UK. In this video, I'm going to highlight on the few reviews regarding the Nursing and Midwifery Council UK OSCE changes. They announced that they have removed certain API stations and some clinical skills from their topics, and they've added new ones. The new ones that they've added are, they've added one API scenario, which is called suspected deep vein thrombosis or suspected DVT. And they replaced two clinical skills with preoperative check and anti-embolism stockings. These are the two topics that have been added to the clinical skills: anti-embolism stockings and preoperative check. And when it comes to the API scenarios, they have introduced deep vein thrombosis as one. They also added a couple of topics to the professional values and the evidence base. You can check it out from the new updated marking criteria from NMC UK. In this video, I'm going to highlight on the main point in the anti-embolism stocking clinical skills. That is why I'm making this video. Before you take your OSCE, make sure you watch this video and then understand the new clinical skill that has been added. Once again, my name is Gentle. Whenever I'm taking candidates through the clinical skills, I try as much as possible to break the steps down or divide them into parts for easy understanding so that candidates can grab it faster so that they can pass on their first attempt. All the elements of the clinical skills, the scene safety, provide privacy, and documentation and all those things still remain the same when it comes to anti-embolism stockings. I have divided this clinical skills flow into 3 equal parts. I've made a division of 3 equal parts. This is the first part. The first part is talking about how you are going to take the measurements of the patient and then proceed to select the right size of the anti-embolism stockings for your patient. The anti-embolism stockings, they come in different sizes. And just as human beings, our bodies also come in different sizes. You need to take a measurement of your patient. That will enable you to select the right size for the patient. Remember, the main purpose or one of the aims of the anti-embolism stockings is to prevent DVT or blood clots in the patient extremities, especially in the lower extremities. So the stocking shouldn't be too loose nor too tight to cause other complications as well. As part of this, you need to make sure that you are selecting the right size for the patient. Taking the measurement is the first part when it comes to my division. The second part is how you are going to assist the patient to put on the anti-embolism stockings. The process you will go through and how you will guide the patient to put on the anti-embolism stockings is the second part. This leads us to the third part. With the third part, the marking criteria requires candidates to offer 5 pieces of advice to the patient with regards to their condition, suspected deep vein thrombosis, or anything around the anti-embolism stockings. These are the 3 main parts I've divided the clinical flow into. So when you are learning, to be easier and simple for you to understand. I repeat, the first part is the measurements and then anti-embolism stocking selection. The second part is how you are going to assist the patient to put their stockings on. And the third part is how you are going to give all the advice you will give to the patient regarding suspected DVT and anti-embolism stockings. Remember, your documentation and everything still remains the same. In this video, I'm going to show you how you are going to take the measurement when it comes to the anti-embolism stocking skill station for adult nursing OSCE. If you are yet to write your OSCE, or if you know anyone preparing to take the test, forward this video to them and make sure they watch to the end of this video. My name is Gentle. What I do is I talk about OSCE, CBT, and other stuff regarding the process to become a nurse, midwife, or nursing associate here in the UK. In this video, Gentle, I'm going to talk about how you're going to perform the measurement, and then that will influence you to choose the appropriate anti-embolism stockings for your patient. In my previous video, I explained the 3 divisions when it comes to these clinical skills, and this is the first one. Now, when you're about to take the measurement, of course, you will need your measuring tape, which in most cases is disposable, right? If otherwise stated, that is fine. You will need your measuring tape. It has its calibration and all that. You are good to go. You will need your disposable measuring tape for this process. We have 3 main steps when it comes to the measurement taking. We have 3 main steps when it comes to the measurement taking. I'm going to take you through each step. By the time I'm done with this video, you would understand and know how to perfectly take an accurate measurement for your patient, so that it will enable you to select the right size of the anti-embolism stockings for your patient. The first step among the 3 steps in the measurement taking is how you are going to measure the upper circumference of your patient thigh. In the first place, you need to assist the patient or instruct the patient to stand. The patient needs to be in a standing position for you to take the measurement. You need to measure the circumference of the upper thigh of the patient. You see, when patients stand, the upper side of the thigh, the circumference, you need to take a measurement of that area. You need to take the circumference measurement of the upper thigh of your patient. That is the first step. And when you get the measurement of this area, that will influence you to go in for a certain pathway when it comes to the selection of the stockings. When we are selecting the stockings too, we have 3 main pathways. And after performing the first step of the measurement, which is the circumference of the upper thigh, it will influence you on the pathway to go. The criteria says that if the measurement that you took of the upper circumference of the thigh is less than 91.4 centimeters, then you need to go for the first 2 selection criteria. That is the thigh length or the thigh length with belt style. If the circumference you measured is less than 91.4 centimeters, then you need to go for these first 2, thigh length style or the thigh length with belt style. On the other hand, if the circumference you took in the first step is greater than 91.4 centimeters, then you have to resort to the knee length style, the knee length style criteria in the selection. The first step is taking the measurement of the upper circumference of the patient. What is the second step in the measurement? The second point in taking the measurement is measuring the calf circumference of your patient at the greatest point. So when patient is standing, you see the calf, great. The greatest point of the calf, take the measurement of that circumference. Take the measurement of that area. The greatest point of patient calf, take the measurement of that area as well. That is the second step when it comes to the measurement taking. Remember, when you take the measurement, you document on your documentation sheet. You take the measurement, you document on your documentation sheet. Now we have 2 values. The first value is the circumference of the upper thigh, and the second one is the calf circumference at its greatest point. The third measurement is to measure the distance or the length from the bottom fold. You see the buttocks of the patient, the place that it folds down, right? Beneath the buttocks, from that end to the heels, you take the measurement. You take the length from the bottom, the curved area of the buttocks to the heels. You take the length of that space as well. That is the third step when it comes to the measurement, and then you document it as well. All these 3 values are going to influence your decision when you are selecting the size of the anti-embolism stockings. So it is very, very important you do accurate measurements so that you arrive at selecting the right size of the anti-embolism stockings for your patient. If you are using the knee length technique, then your third point or your third step in the measurement will differ from when you are using the thigh length and the thigh length style in the measurement. When you're using the knee length technique or the knee length style, then your third measurement, you will measure from the knee to the heels. You measure from the heels to the knees instead of the previous one. When you're using the thigh length technique or the thigh length style, you measure the third step, or the third step you take a measurement from the buttocks to the heels. On the other hand, if you are using the knee length technique, you rather make the measurement of your third step from the knee to the heels. Thank you so much for watching. Don't forget to like and share. In the next video, I'm going to explain how you're going to use these figures to select the anti-embolism stocking for your patient. I repeat, the 3 steps are measuring the circumference of the upper thigh of the patient. 2, measure the calf circumference of the patient at its greatest point. 3, measure the length between the buttocks fold and then the heels. Thank you.